I'm just going to sort of run through where we're at and how we got here as far as the fire department and the city's response to the COVID-19 situation. As you mentioned, I'm the fire chief, also the emergency management coordinator, and responsible for activating the city's emergency management plans. And our plans are usually to respond to weather events and the things that would affect the city's operations or the infrastructure of the city. And that's usually what our plans are geared to. And we're very good at that. And we train at that all the time. We don't really train for pandemic responses a whole lot because, once every 100 years, why would we train for it, right? So this is a little bit different for us, and because it's not an infrastructure situation or city operations as much as it is. It is, but also it affects people in all aspects of life. So it's been a challenge for us, but I think we're rising up to it pretty well. As far as the fire department, what we've done early on, we just watching the news, we knew that this pandemic was headed our way. So we made sure that all our employees had their N95 masks ready to go. And we thought at the time that it's probably all we're going to need. So we started doing that back in early March. And once we got ours tested, we went to the police department to make sure all their masks were fit tested. So they were ready to go. So that's the beginning of what we did. And then from there, we adjusted our response and just operationally speaking. And some of those things included adjusting our shift schedule so that we reduce the amount of times that employees are coming and going from home to work. We practice the same distancing that you would in public, at least the best we can, which is tough for us because we never work in teams of less than 2, and it's usually many more than that. So we're doing the best we can with distancing and isolation. We've adapted our training so that we have 3 stations in Portsmouth, so we don't bring all the stations together anymore. We train individually at each station, so we've adapted that a little bit. We restrict station to station movement to what's just operationally necessary. We do temperature and health screenings when you come to work on shift. Even myself, every day I do a screening and a temperature check, and it's done every 12 hours that they're here to make sure that something didn't happen to you while you're at work or become symptomatic, because if you are, we're going to send you home. We've minimized our non-emergent contacts with the public, mainly through inspections. Our inspection division is we're keeping up with the inspections that are necessary. If a contractor needs an inspection done to move on to the next phase of a project, we're doing our best to get that done, and we're finding a way to get it done. But routine place of assembly and that sort of stuff we've put on hold for now. Burn permits, we're not issuing burn permits. If you have a backyard permit that you use for your chimney or whatever outside, it expired in December. I've extended that to June, so you don't have to worry about renewing that right now. And we're responding to calls differently. We've always adapted in the fire service to do to new information. We don't fight fires like we did 20 years ago, because the way we did it then, we were getting cancer. So we changed the way we do it. It's like medical aid calls now. We don't do medical aid calls like we did 3 months ago, because if we did, then we'd be susceptible to contracting the virus. So you'll see our guys, if they're on the street now, they're wearing masks and eye protection at a minimum. And then they ramp up their protection from there based on the call. Even routine calls with the fire trucks, carbon monoxide investigations or car accidents, you'll see anytime anyone leaves the building here, they have that minimum of mask and eye protection on. And all of these things are being done so that we can stay healthy, and if we have any problems, they're compartmentalized into one group at one station. The worst thing that can happen for us is we have one person become symptomatic and infects an entire shift of 14 people, and I lose a quarter of my department at one time. So all of these measures are being taken to reduce that probability, and also to protect the public. The last thing we want to do also is to transfer, an infection from one house to the next by going from one patient to the other. So all of these things are done with that in mind. And the police department, with Chief Murner and his command staff, we've been in lockstep from the beginning as far as our preparation and response. And, they respond in similar fashion as we do as public safety. So they've taken all the same measures as well. And we've been working closely with them to make sure that they're as safe as they can be out there as well, as far as their equipment's concerned. As far as the city, overall city response, we first met on March 13th under the direction of City Manager Connor, and all the department heads have met. At the time, it was every day, 7 days a week. We're down now to a couple times a week now that we meet. All the department heads meet in a phone conversation, and we pretty much just tackle the problems that come up day to day. It's essentially, we have an emergency operations center that we would activate for, like, if there was a weather event or a disaster event going on. But since we all can't get in the same room anyway, we're actually doing a really good job of being a virtual emergency operations center, and we're all connected by phone and email and text. And I can tell you that the emails and texts start at 6 in the morning and sometimes don't end until 10 at night. But I could tell you is our department heads, we don't often work. We sometimes work together to solve a common problem between a couple departments, but since mid-May, we're meeting every day and as a group, and we've become a really cohesive unit, and we're all working together to solve problems that wouldn't normally fall under our purview in our specific department. As an example, Peter Rice and his crew at Department of Public Works, we were faced with a problem that our homeless population had no place to take showers now because the place they were showering, the place they would do that are closed. So came up with a plan with the help of Ellen Tully and the welfare department and Peter, and they got together and they rented showers and they found volunteers to run it and place to put it. Steve Butzel at the library, they have 3D printers. They've been printing out straps to help ease to make more comfortable wearing of surgical masks for our hospital nurses and nursing home nurses. Bryn Sullivan at Senior Services, she's doing in the middle now of a mask drive so that our housing authority population and in the apartment buildings, they're more protected. They're wearing so they can get the mask to wear so that they feel more protected and help control the spread there. And they're a vulnerable population that we're really concerned about. And even Rusty Wilson in Recreation Department, and the Easter Bunny Trail was his idea. We just gave him a vehicle to drive the bunny around in, but the logistics of that were his, and that was a lot of fun. And just an example of how all the departments are coming together, and we're all coming together under the leadership of our city management team with Karen Conard and Nancy Culper-Puff, and I'm happy to report that no problem has come forth yet that we couldn't handle as a group, and it feels good to be able to do that. As far as other stuff that the city response, and on my end, I'm in constant contact every day with the hospital, with Malachi Fisher. He's the director of EMS and emergency management there. I get a feeling from him every day. I get the census of the hospital, and to me, that's the best measure of how the community is responding to the pandemic is how full the hospital is. So I use that as my barometer to see how things are going here, and I'm sure Mr. Crucci is going to report that things are pretty good there. 3 times a week, I'm in on a conference call with the State Emergency Operations Center led by Homeland Security, Emergency Management, and Commissioner of Safety. We get constant updates and procedure recommendations as to what to do best to handle response to the pandemic. Weekly conference call with the governor through the mayor and city manager's office. We get updates mostly on economic and social impacts of the pandemic. And I'm also in a constant daily conversation, if not more than once a day, with area fire chiefs and emergency management directors, just to make sure that we know what's happening regionally and that we're responding, as quickly as we can if something starts to happen. As far as the current situation now in Portsmouth, I think we're doing pretty well. I mean, we're seeing cases like we knew we would. The cases are cumulatively increasing like we knew they would, but what I would consider a manageable rate, and I think we're managing it pretty well. And it's a direct result, in my opinion, of our preparations and plans. The school department and Steve Zadrovic closing the schools as early as he did, I think was a good call. And just following the governor's directives of staying at home and social distancing and limiting gatherings and so on, I think we're seeing the fruits of all that labor at this point. I think we're far from exceeding the level of what our healthcare facilities can manage, which, that's the ultimate goal in a pandemic response, is to reduce the impact on that. Our cumulative numbers are going to continue to grow, but again, I think, at any given rate, any given time in the week as far as our infection rates. It's more manageable at this point. To that point, though, I think we can't become complacent with the governor's orders and the social distancing and the gathering. We need to be vigilant. We need to keep taking it seriously. And as far as reentry, I think the governor's office and I think the state EOC and Commissioner of Safety will have a good plan for us to start reentering when that time comes. But it's also important to not jump the gun on that as well, and do it in a way that we don't have a rebound of infection. I mean, can you imagine how devastating it would be here in Portsmouth if we ease things up and then there was a rebound in the months of July, August, and September? We have to shut down. I mean, it would be devastating for us. I guess to start wrapping things up for me, I want everybody to know that the fire department, police department, we're here for you, still fully staffed. We're healthy. We're 24/7. We're doing exactly the same thing that we've been doing all along. We're responding to any emergency that you call us for, and we're ready to go. And it's been that way all since the beginning of the pandemic response. And we've prepared, and as much as we prepare for that, we're also still training and preparing for our day-to-day operations. We just got our boat back on the water, and we're going to start training on that. Actually, they're out training on that, I think, this afternoon. So it's business as usual as far as our other emergencies are concerned for us. Also, I want to take this time to put a huge thank you out to the community. Their response to our efforts has been phenomenal. As far as we had a protective equipment drive, a PPE drive a few weeks ago when it was tough to get PPE, and I know the public responded just phenomenally. We had a whole room full of stuff now, and we received monetary donations to buy PPE, and it's just been fantastic. It's unusual for us, to get help from the city, because we feel that that's our role, is to be there for them when they need something, and it's just been great, the response from them, and I want to make sure that the thank you goes out to them for sure. And lastly, it's going to take a community effort to get through this, and it's clear to me that our community is rising to the challenge, and we will get through this. I'm a baseball guy, and I miss baseball terribly right now, and I'm an umpire for the local Little League. I miss doing that, and in my opinion, we're like in an extra innings baseball game right now. We're tied. There's no clock in baseball, so you don't know when it's going to end, and all you can do is keep rolling your defense out there and making plays and making outs and living for another inning until it's over. So that's how I'm looking at it, and that's my report.